Again, my name is Josh Yoder, Director of Research Informatics Services. I'm with the Department of Biomedical Informatics, as is Jeremy Harper, and I'll actually let you introduce yourself.
I'm Jeremy. I'm the Director of Research Enterprise Systems. I focus on a lot of different areas. In this case, you'll hear a lot about our IHIS focus and how we're leveraging IHIS to do recruitment.
Thank you. And my primary focus is electronic data capture, as well as secondary use of clinical data from the electronic data warehouse here at OSU. And so Jeremy and I sat down and started talking about the various informatics tools that are available to the community. And we started with the two topics in terms of recruitment and retainment. And being informaticians, we decided 2 was not enough, and we went to 5. It was actually 6, and we condensed the middle one down into 2. So these are the categories that we'll be walking through today, introducing some of the tools and more specifically the implementations of tools and how to use those tools within the context of this particular topic. The first area of focus is in cohort identification. And so this isn't something that a lot of people think about in terms of when they speak about recruitment, but it really should be one of the first steps, at least in my view, from an informatics perspective. And so some of the solutions that we have in-house here at OSU, and we'll talk specifically about technologies. Technologies are different between institutions, so I know Nationwide Children's Hospital has their own set of technologies, as does Ohio University, who I think we have a good number of representatives in the room for. But we'll be hopefully talking about higher level usability, as well as focusing in on some of the technologies as we move forward here. And so some informatics solutions in terms of cohort identification, EHR tools, so specifically to Epic, the slicer-dicer tool, which is...
Here in May 2016, we'll be implementing Epic's newest version, which is going to release a lot more research functionality. Unfortunately, that's still a year away, but it's an upcoming capability. Right now, only our physicians are able to use the new search features in Epic 2014 that was just upgraded.
The Organizational Enterprise Data Warehouse, that's been coined the Information Warehouse here at OSU, but most institutions have some level or form of an Enterprise Data Warehouse for use. Some self-service systems, I2B2 is one that we'll actually drill down a little bit farther to later on in the presentation. And things like participant registries. You heard about Research Match earlier this afternoon. Some considerations when looking at feasibility, which is one of the reasons why you do cohort identification. Really looking at the size and locale of your population of interest. Many of the tools mentioned above, especially I2B2 and Research Match, can help you specifically in that realm. Anticipated accrual rate, so identifying the population of interest over time, something like the Information Warehouse or Enterprise Data Warehouse would help you do that by taking a retrospective look at the population over the previous years or months in your area. The effect of planned inclusion-exclusion criteria. And so if you change your age range from 18 to 25 to 16 to 32, what does that do to the population that is within your area? And then complicating factors, and so complicating specifically here in terms of informatics and the tool sets that are available, but also in terms of just performing the research that you have planned. And so things like collection of biospecimens or the use of images, the use and storage of images.
One of the other complicating factors can just be where the data lives. You know, as you know, we did a big bang implementation of Epic in 2011. Before that, data lived in many different databases, and while we've centralized them in the Information Warehouse, being able to go back and query at what time, at what location, we actually have valid information for your potential research subjects is a very important feature that you're not going to get with many of the automated tools. It's not going to be able to tell you that the 900 results that you're receiving were all identified in 2011, whereas a research analyst is going to be able to identify that for you.
So we're going to dig a little bit further into what's called the OSU Research Data Repository, or RDR. And so this is currently, we have a proof of concept up and running here at OSU. It's currently a project that we're working with the Information Warehouse and the Medical Center IT group. It's based on I2B2, which hopefully some of you are familiar with, which is a national tool. Ryan's smiling, he's a major part of the project. This is really to allow researchers to have a tool that provides some self-service capabilities to do some cohort discovery. Have a couple, I should say it will be available in August of 2015 based on the current end date of the project plan. The interface is fairly simplistic, and so it provides an ontology that researchers can drill into. The numbers that you see next to each of the ontology items is actually a population of patients that's within the database. And so as you can see, if you're looking at demographics and want to identify the number of, or the cohort in a summary view, this would be a good tool to use. I ran a very simple query in our proof of concept to give you an idea of what the tool would allow for. Specifically looking down here at the query output, so I simply pulled in inpatients that were females, gives you a total population count, and then you can very easily do an age breakout. And so this will hopefully help in those formative stages of the research plan as you write your protocols and begin to approach the IRB.
It'll be particularly helpful when you have very tight turnaround times and you don't have the 2 weeks necessary to go work with Josh Yoder's team to put in the query request and get an analyst assigned to work with you.
Right, so I should mention the CCTS, since this tool is not yet available, the CCTS has subsidized the salary for IW analysts to perform queries for researchers, working one-on-one with them to do this type of analysis. Of course, the self-service model will be much appreciated on both ends, I'm sure. So moving into the next realm in the life cycle of the topics that we're covering today, recruitment and some of the tools that are available there. And so looking at specific Informatics Solutions, a lot of the tools are the same, but the way that you would use those tools within the recruitment realm is slightly different. And so you'll see again the Enterprise Data Warehouse is listed. There are some EHR tools that Jeremy will be going over. Project registries such as Study Search, and so that's a way to really sell the fact that your project is available for participants to get some no, just rose up to get some eyes on your protocol, essentially. And then things like participant self-identification, putting a project URL on a poster and making that available for participants to answer on their own. Some considerations when looking at these specific tools, of course, IRB approval is required to contact patients that are within the OSU health system. And there are specific criteria for CTA triggers, which we'll be talking about here shortly. The two examples will be speaking to our CTAs, clinical trial alerts, and then Information Warehouse research data requests.
So before we jump into clinical trial alerts, we do support quite a bit of modification in Epic and support our research coordinators. So I just wanted to talk through a few different things. Some of the pre-screening capabilities in Epic have been really challenging for us to create truly automated systems, because when we go work with our research coordinators, we identify that they're really recruiting for 10 different studies from the exact same clinic. So what they do is they go through each patient chart in that clinic and they say, is this person eligible for any of the 10 different studies? That's not something that we can support electronically, because what we do is we build reports specific to your research study, and it tells you the people who are eligible for a specific research study. But we do work with our research coordinators to identify the best workflows and the best capabilities to do pre-screening. We also work with them to do scheduling, and there's a a lot of benefit to that after you've recruited people, as well as seeing the clinic schedules, as well as reporting. So, clinical trial alerts. They leverage the best practice alert technology and the electronic health record. For those of you who are not physicians, what basically happens is during your workflow, you take an action. It identifies that action meets certain criteria, and it stops your workflow doing a pop-up saying, please be aware of this information and take this action. So what we're doing is we're taking that best practice alert pop-up and we're doing it for clinical trial recruitment. So we're saying, show me patients who have a certain order placed on them, show me patients who meet certain ranges of criteria, and I'll go through more information about drilling down into clinical trial alerts. As well as we have additional actions that can be taken to further assist the decision making. So right here is a base clinical trial alert example. You'll see we've got, it basically pops up for the physician. You'll see that it shows up here with all the detailed information. We can pull in dynamic text such as the age of the patient, the sex, gender, as well as we can pull in qualifying diagnoses. All we ask the physician to do is to say the patient is interested or the patient is not interested. We only implement clinical trial alerts if you're already working with your physician population. We have an opportunity to educate them. So if you're looking to implement for everyone across the enterprise for an asthma study, we do have a way that you can go through and request from committees permission to do that. But we found that it's much more useful and much more compelling to our clinical physicians if they already know what the study is and why they want to be recruiting for it. What happens after you say the patient is interested, it sends an in-basket message to a clinical research coordinator, and then they can do the follow-up and get the official signed documents to have the patient accrued to the study. We also are able to send a page to the research coordinator if we need to, so that the coordinator knows you need to check your in-basket because someone's on site right now and they've just said they're interested. So for those of you who aren't familiar with where clinical trial alerts are, another way, we have triggering actions such as opening the chart where we can just do a pop-up in your face, searching navigators, opening order entry, order signing, file flow sheets. We also, in most of your visit navigators, have an area called best practice. And in that area are these research trial alerts also pop up. And it doesn't interrupt your workflow. It's just as you go through your navigator activity, they'll show up if we've identified as anyone eligible. So this is just another one that I built specifically for the tools of the trade, showing we can pull in age, gender, and we can also pull in discrete documentation surrounding the patient chart. So if we are looking specifically for flow sheet values that have been met, such as that BMI or other criteria, we're able to pull it directly into the notification for the clinician. Here in this specific example, I also had a hyperlink that allows me to launch directly to chart review. If that's something that you're interested in, we can also set it up so that a patient is automatically accrued to your study if you perchance are if you're not working with a clinical research coordinator. So this is just an example of where we've built discrete documentation in the patient chart that I was pulling in before. Again, we also have the patient is interested, patient is not interested, and launching directly to chart review. So the other actions that we do have options for are we can create activities, care plans, health maintenance activities, task templates, and send in-basket messages with these clinical trial alerts. So we are able to help direct the clinical workflow to do exactly what you're trying to accomplish with your research. So sometimes your research is asking us to step outside of our normal clinical workflow, and we do support that with these. We also have the ability to automatically queue up specific orders With smart sets, pathways, we have the ability to place single orders, as well as the ability to suggest triggering order removal. So if they're ordering something and they've just said they're accrued to the study, say they're ordering a surgery that we're trying to accrue for a different type of surgery. In addition, we also have these follow-up options. We have adding issues to the problem list, adding FYI flags on the patient record. That one we're going away from. We've used to use it a lot for research, but it's still a capability. Storing discrete data in the smart data elements, as well as assigning questionnaire series to the patient chart. So questionnaire series are questions that they could answer at home on my chart or in the clinic while they're there. This is just an example of, we do have the ability with in-basket follow-ups to assign to individual recipients, classes of people, or pools. So depending on the size of your study and who you have involved, we have some flexibility there. Our information data warehouse request, that was also one thing that I wanted to talk about. So as part of your recruitment process, if you need to identify a cohort of people to contact, we do have the ability to do an information warehouse research data request. You can ask for patient contact information based on your cohort of interest, assuming you have an IRB for that. You must have your project defined in the computerized research record core system. It's a project management tool that we use, put out by the CCTS. You can go to researchrecord.osu.edu to put it in. Basically, put in your service request for information warehouse data, and then our informatics team will triage that request, help identify exactly where you need to go so that we can actually get that data for you. Again, Josh, you can speak to this. This is your team. But my experience lately has been 2 to 4 weeks, and they're already contacting me and working with me directly for these research requests, which is a vast improvement even over a year and a half ago when you inherited the department.
Right, and specifically for these types of requests, because they're fairly simple. I don't like using that word simple, but compared to some of the more in-depth research requests looking at retrospective data and analysis, these are generally turned around fairly quickly. And so as soon as the documentation is received and reviewed, those are being directly assigned to an analyst for immediate action. And so this is actually a great way to identify potential participants from the set of patients that are here within the medical center walls.
Should you do an information warehouse data query and you have IHIS access, but you don't have access to type in any MRN, we're also able to create a report based on that MRN list that they provide that gives you access to those patient charts and only those patient charts, saving a little bit of time on the medical information management team's part, where they've historically had to send you each patient chart directly, which is a little more challenging and time consuming for everyone involved. So just talking a little bit about screening and consent, we've got participant screening. Our Informatics Solutions include IHIS reports, participant registries, so research match, electronic contact, personalized Redcap emails, EHR consent tracking, so we have IHIS consent flags. We also have screening consent considerations. We match the technology modality to the user and to the environment. So 2 of the examples that we have today here at OSU are IHIS screening and consent tools and Redcap contact functionality. So for everyone who has IHIS access, if you go into your My Reports activity, there's a library button underneath that you can just type in research, and you'll see all the standard research reports that we have available for you today. Paula's released some fantastic documentation talking about all the different reports that we do have available for you and how to leverage them. We have reports that allow you to find all the people who you've accrued to your study. We have reports that allow you to look up all the upcoming appointments for participants in your study who are coming to OSU. We also are able to build specific screening reports in IHIS that allow you to find people who are have upcoming appointments. So that's the IW report I was just talking about. So in IHIS, after you've screened the person and you've consented them, here in the right-hand corner, you'll see the RSCH active. So that indicates whether or not someone is research active or inactive. All you have to do is you click that area, and it launches you into the research studies activity, and you add your study and the patient flag in particular. That capability is something that we want all our research coordinators doing, because then we can use that to help identify for all our follow-up reports in the information warehouse, as well as other behavior activities in IHIS. So in this upcoming year, we've got a lot of fantastic, exciting capabilities that are coming up. Josh was talking about I2B2. Epic is releasing in May 2016 MyChart recruitment capabilities. And so this is the technical capability. We're still navigating how it'll look exactly here at OSU, but they're creating a specific MyChart activity that is for research and to tell people about different research opportunities they may have. So that'll be implemented in May 2016. We're pretty excited about seeing that coming up. One of the other things that I didn't remember to put into the presentation is Apple's new research kit, the mobile activities for releasing apps that are specific for recruitment. That's another area that we've been actively engaged in and working very hard to identify exactly our process. We're working with the OCIO so that the OCIO already has a process for delivering branded apps to the Apple App Store and other app stores. And so we're working with them to identify a process so that you can have a branded app that's for research. Part of that is your recruitment, part of that is your questionnaires, and we've been working with the IRB. If that's something that you're already pursuing or interested in, please contact me and I'll help connect you with the right people.
So moving on to Redcap. Are people familiar with Redcap in the room? Is there anybody who's not? It's an electronic data capture tool. So it's one type of technology. There are others out there. Encore has much of the same functionality. And so I'm highlighting Redcap because that's what we have here, but a lot of what you see is really available in several different technologies. If you're not from OSU and from another institution, I'm sure that your institution has some technology that's deployed that has very similar capabilities. And so for within the realm of screening and consent, some of the functionality within Redcap is managing survey participants. So you have the ability to, as I mentioned earlier, create a generic link which would allow potential participants to fall into the landing page and fill out some information, including contact information, assuming IRB approval, of course, and allow you to identify potential participants through something like a poster or a generic email blast. There's also a way to load emails into Redcap to send out to a specified participant list. So if you have a listing of perhaps patients from an IW data request that, again, is approved for use in this capacity, you could load that into a tool such as Redcap to contact those individuals with some level of personalization embedded within the tool itself. And then, of course, once invitations are sent out, as well as the public survey link, there's a way to track the activity that occurs within Redcap. So moving on to retainment, which I think is often overlooked, especially from a technology perspective. Some of the information, or some of the Informatics Solutions that are available are appointment monitoring, specifically around IHIS appointments here at OSU. Electronic scheduling via something like a Redcap calendar, and then automated reminders and updates and newsletters. So not necessarily informatics heavy solutions, but something that can be done generally within the research team without having to pull in an informatician such as Jeremy or myself. Some considerations, try to utilize data to really minimize that participant inconvenience. And so with something like IHIS appointments, if you know that a participant is coming in for an appointment, perhaps for another reason, being able to try to coincide those appointments within the same time frame while they're at the facilities makes sense. Implement a robust communication plan. I think that's already really been touched on previously. And automate communications when feasible. You don't want to have to remember to send something out at a participant level. It's great if you have a tool where you can really automate your communications out to your participant group. Specific examples we'll be touching on IHIS future appointment reports, and then the Redcap scheduling and communication piece.
Sure, and the future reports is what I've already touched on, so if you want to.
Okay. So within Redcap, just some screenshots around being able to define events within Redcap, so longitudinal events that occur over time. You can associate instruments with those events, of course. And then creating participant-specific scheduled events. So when a participant joins, here are the steps that are going to occur for that participant across the space and time of the specific protocol. And then a kind of general global calendar that's available for the research team to view within Redcap. And then the final phase, follow-up, we kind of made this one up a little bit to fit a specific example, which is the registry platform. And so some solutions that exist out there are clinical data management systems, electronic data systems such as Redcap, which we've already touched on a bit earlier, or a registry platform. We're going to cover research registry, research registry pipeline specifically. Some considerations when thinking about this long-term follow-up. What is really the required follow-up period for the project or protocol that you're working with from a scientific perspective? And so everybody wants to follow everyone for life, but is that what's really needed to reach the scientific goals and ends of the research that you're doing? The possibility of remote data and or material collection, and so requiring a participant to come back to a specific geographical location for the rest of their life may not really make all that much sense. And then planning for communication intervals and the specific content within that communication are really ideas to think about as you look at what tools are available and make sense for your research within this domain. So moving on to the example, looking at registry platform. There's actually several solutions available, not just OSU, but of course to the general community. Within the EHR systems, there's often a module that is called the registry module, right? Within Epic. I don't know if there's a specific name for it or not.
It's just the registry module.
Okay.
We also have our CTMS system, which is Encore. The Cancer Center already has it implemented. We're implementing enterprise-wide.
Right. And then custom-built systems. The example I put up here is the Total Cancer Care Protocol, which BMI was involved in the technology development within that program specifically. But there's countless other systems that are custom-built for specific registries. Key considerations to think about in terms of registries: is it a single site or multi-site registry that you're planning to launch? Is it a centralized or distributed data model, meaning the data that's collected at one site, does it remain at that site, or is it at a central site in one large database? Hand data entry or ETL. ETL is extract, transform, load. So that's a standard warehousing term. Are you manually entering data or collecting data on paper and then manually entering it in? Are you able to pull information perhaps from something like the EHR or electronic data or enterprise data warehouse? And then again, looking at complicating factors such as biospecimens or images that might be included. So the specific case study we're going to look at is the research registry pipeline. This is a
joint collaboration between the CCTS and Biomedical Informatics. So they announced its release 3 months ago, I believe.
At the last Tools of the Trade.
At the last Tools of the Trade. So we won't go into in-depth detail, but we just wanted to point out that it is one ability for you to go in. You can pull in from multiple data sources, integrate it into one centralized query platform where you're able to identify what's happening with those specific subjects at any given time, what new data is coming into the system, and how you can better interact with them
Yep, and we're running out of time a bit here, so I'm going to slip. I think that's why you interjected there.
Sorry.
That's fine. So a very high-level architecture, multiple data sources feeding into a single OMOP data model, allowing access to investigators through a query portal. This is a more in-depth architecture diagram. Probably the most important thing is looking at the way that researchers would access this data. There's both a graphical user interface, but then there's also the ability for statisticians and bioinformaticians to directly access that information out of the database itself. And this is just a screenshot of the UI, which allows researchers to do ad hoc queries against that underlying data model without the assistance of an informatician or a biostatistician. And that's all. So I think we have a few minutes for questions, perhaps one question.
Sure.
What more can you tell us about that? Is that going to be real limited, or?
So they've already done the programming, so we already have a very good idea of what it's going to look like. How we're going to implement it here at OSU is still under discussion, but it's an area that we're very interested in moving forward with, especially because it's standard Epic modules, so it's actually going to be a lot of work to pull it out of the system. And so at this point, we're still identifying how exactly it's going to look and look for more information as in the upcoming months.
Would there be a cost for it?
So
Use?
for that module itself, there's no cost. For the surrounding infrastructure, we don't know yet. Some of that's Epic's going to be releasing quite a bit more information in July or August.
Any other questions?
Can I just, you mentioned in terms of looking for patients for studies, that there was slicer, dicer, and I2V2. Is slicer, dicer things that everybody's going to be able to use? This is so you're an Epic, you could look for your diabetic with A1Cs greater than 7 who are 25 years to 30 years of age. Can slicer, dicer do that?
So
I'll let
we are
Jeremy take that
receiving
one.
quite a few requests. It is a technical capability of Slicer Dicer. Our physician population are the only people who have access to Slicer Dicer, and as part of that access, they get specific training that says you should not use this for research. This is not appropriate for research at this time. Epic is still building infrastructure to help us be able to track and identify when people are doing it for their clinical or quality use cases and when it's in use for research. It becomes very challenging for physicians because they have all this access and it's basically an on or off. They have the ability to do all these queries, but it's not appropriate to use Slicer Dicer at this time for research until after we've implemented more infrastructure so that it can be monitored.
And that's very similar to how Answers is now, where the capability is there, but for very good reasons, it should not be used for research specifically because it will return you identified information while you're doing research questions. And so that requires that honest broker concept, at least from my perspective.
Yes,
In essence, though, you can do that in your reporting warehouse right now.
we can.
That's right.
Any physician can do that right now, and they're using, not reporting warehouse, rather, on your My Reports, the research reports,
Within IHIS or?
within I.
Okay.
So they have to have an approved IRB before we build any research reports for them.
Right,
And that approved IRB says what areas they have access to and where they can screen and where they can't.
To some extent, it's naive to believe a new drug comes out and there's a reported side effect. And so that's clearly, you want to get your patients on the drug that has something.
Sure.
So you would want to search for that. And then while you're doing that, you go, well, my patients are also on this drug that has that same side effect. Maybe they'll explode if they're on both.
Sure.
And you want to look for both. And so now all of a sudden you're going from a clinical to a potentially research question. as long as I thought it was my patients and I have right to do this.
So that's where it becomes it's a gray area, because you as a physician have access to your patient population, your patient information, and that's something that if we should take offline and talk to the IRB. And
Well, let me just, what about I2B2, which has this
Mhm.
capability as well? When will that be available? And will that be at the coordinator level, or will that be just at investigator level? Who will have access to I2B2 that can do the same thing using
de-identified
Right,
information.
now it won't be the same thing because the only data that will be returned from I2B2 is a summary of information, so a count of patients. There won't be any identifiable information. As to who can gain access, there will be required training, but the IRB outlines that really anyone at OSU can gain access to that.
So any employee.
Well, thank you very much, Josh and Jeremy.
Thank you.